El Paso's health authority says El Pasoans still need to get tested despite the CDC's new recommendations relaxing testing guidelines. I reached out to the Texas Tech infectious disease expert, Dr. Armando Mesa, to see if he agrees and if testing should be boosted rather than scaled back.
I think the guidelines are, in a way, only helping you to make a decision to determine who you should consider for testing in terms of the priority. That is that if you look at the specifics of that, it leaves a lot of groups that despite the recommendation of not getting tested, they should still be tested. And the so-called vulnerable populations, vulnerable populations will be those individuals who have diabetes, who have advanced medical conditions, hypertension.
El Paso has a high propensity for hypertension, high propensity for diabetes. So the majority of El Pasoans fall under that guideline. Then secondly, won't this confuse our viewing public if you say get tested, but no way CDC says don't get tested?
I think so. The recommendation, again, you will find most likely a particular category that will put you at risk, either because of your personal risk factors or because of your risk of exposure in any clinical situation. So I don't think that this should be a way to not test, but more to use your judgment and the assistance of your provider to get you tested.
Dr. Hector Carranza, who's our health authority, El Paso County and City Health Authority, says we're not going to follow those guidelines. We're still going to continue to tell everyone to get tested because the flu season is upon us. Good idea, bad idea?
No, I think it's reasonable. And actually, if you look at those guidelines, there's also a statement at the bottom of that piece of that document that states that you should still follow your local guidelines.
Now, Dr. Mesa tells me another reason people should continue to get tested is because he says at least 40% of our population can be asymptomatic, a carrier of the virus, and may not even know it. Stephanie?